The intensive care team, as well as the critical care team, they take care of an estimated 4 million patients right here in the United States of America every year. Now, this accounts for about 15 to 20% of a hospital's total cost. Many of your loved ones are admitted to the intensive care unit despite the best care possible, though they may not survive. The family of a loved one who is admitted into a critical care unit, they can certainly go through a very stressful time. The critical care team, those members try their best to help family cope during this very stressful situation. You just saw Halo Flight bring in Mr. Jones to the emergency department. Let's see what Mr. Jones' family learns about the intensive care unit and how the critical care team operates.
Hi, I'm Mrs. Jones, and this is my son David and my daughter Julie.
I'm Jackie, a registered nurse in the emergency room.
My husband's been sick for a few days. Today, he had trouble breathing, and we called 911. They put this funny tube in his mouth and took him to the emergency room.
Your husband is in critical condition and has been moved into the intensive care center.
I heard that most of the patients that are in the ICU eventually die.
Mrs. Jones, this is a myth, not a reality. The intensive care unit is a place where patients who are critically ill are admitted. These services are offered to those patients whose conditions are potentially reversible and they have a good chance of surviving with intensive care treatment and use of artificial life support. 79 to 85% of patients who are admitted to the ICU survive.
Nick, I saw my dad when they were wheeling him to the ICU. He had a tube down his mouth and several tubes going through his arms and legs. What is going on?
Dorothy, my sister, can answer that question. She used to work as a nurse in the intensive care unit.
Every day, patients get admitted to the hospital, and for many different reasons. Some suffer traumatic injuries from a car accident. Others have had a stroke. Some have heart problems. Some have a brain injury or suffer from very high blood pressure or problems breathing, as is the case with Mr. Jones. The doctors may send patients to the intensive care unit from the emergency department. Some patients are transferred from another part of the hospital or from another hospital. When patients are critically ill, it is taken care by a team of caregivers. The team can be comprised of doctors who specialize in taking care of critically ill patients, nurses who are trained to provide care to critically ill patients, as I used to do, respiratory therapists, consulting physicians, pharmacists, caseworkers, dietitians, resident physicians, social workers, and a chaplain or spiritual caregiver.
That sure is comforting that they work as a team to provide the best care for my dad.
In the intensive care unit, they use several tubes or devices to help patients breathe, give medicines, or monitor their urinary output. The small plastic tube you saw in Mr. Jones's mouth is called an endotracheal tube, or ET tube. This is placed through the patient's nose or mouth. This tube is then connected to the machine, which helps them breathe. This machine is called a ventilator or respirator. You may have seen another tube coming out, which is actually draining urine into the bag. This tube is called a Foley catheter. It is put into the patient's urinary bladder, and the urine drains into the bag. It helps to exactly measure the patient's output of urine on a continuous basis. This assists the doctors in treating him better. During the patient's stay in the intensive care unit, the patient undergoes frequent laboratory and blood draws as well as x-rays, which help their doctors to make better decisions. This is done to help guide the therapy so your loved one can get better. They also sometimes draw a small amount of blood from their artery called ABG, or arterial blood gas, which helps to exactly know the content of oxygen and carbon dioxide in your loved one's blood. This helps us to provide them optimal breathing support.
This is Sarah, your intensive care unit nurse. I'll be back in the ER.
Hi, Miss Jones. I'm Sarah, the intensive care unit nurse that will be taking care of Mr. Jones from now on. And this is Dr. Graham.
Hi, Mrs. Jones. I'm Dr. Graham. I'm the resident physician who's going to be taking care of Mr. Jones in the hospital today. Mr. Jones has come with a bad infection of his lungs. We have already started filling him with fluids and antibiotics through his veins, but his veins appear to be very poor, and we need your permission to go ahead with a central line placement and a bronchoscopy where we go and clean out any infectious secretions of his lungs.
What is a central line placement and a bronchoscopy?
Central line is a procedure where they place a tube or catheter in the large veins of the patient's neck, under the collarbone, or even in the thigh. They are used to give medication and fluids, some of which cannot be given through via small veins. This can also help measure the pressure in those veins, which helps us determine how much more fluid to give, as well as it can be drawn from blood without those ever being stuck by the patient. Bronchoscopy is a procedure where they place a tube through the patient's nose, mouth, or an existing breathing tube into their lungs. It helps us cleaning any infectious secretions to take sample of the lung tissues of any abnormal area in the lung. These are the procedures which are carried out by the patient in the intensive care units on a regular basis to help your loved ones recover quickly and to help them. Mrs. Jones, before we proceed with any procedure, I need your informed consent. It says that I voluntarily request Dr. Serrani or his associates to place the central line and to perform a bronchoscopy. Here is the disadvantages, advantages, risk, benefits. It's all in here, ma'am. Also, let me know if you have any questions. I would like to answer all your questions before we proceed with any procedure.
Patients in the ICU are not always able to make their own decisions. Family members may be asked to make some of these decisions for their loved ones, and that's the reason why your doctor may have asked you to sign a consent form to ensure informed care of your loved ones. Be sure that you understand what your doctor wants to do. Ask, why is it needed and how will it help your loved one? Ask about any risks related to the procedure. Before signing the consent form, get all your questions answered. Always keep in mind and respect what your loved one would have wanted.
Thanks, Dr. Graham, for explaining all the risks and benefits of this procedure.
I'm glad the doctors and nurses are so helpful. My dad had something on his chest and a probe in his finger. What are those?
In the intensive care unit, they have several leads and probes to monitor the patients on a continuous basis. The leads that you saw on the chest of Mr. Jones are called EKG leads. These are the wires attached to the sticky pads and put on the patient's chest. This checks the patient's heart rate and rhythm and immediately alerts the nurses and doctors of any changes even before the patient experiences the symptoms. The probe on Mr. Jones' finger is called a pulse oximeter. It's usually placed on the patient's fingers, toe, ear, or forehead. It gives constant information about the oxygen status in the patient's blood. You may also see a small tube coming from the patient's nose or mouth. This tube goes into the stomach. It helps to give the medicine or liquid food to a patient who can't swallow. This tube may also help doctors to drain the stomach of air, blood, or fluid.
Dorothy, I saw a tube coming out of my husband's chest. With a tube, it looked like it was draining blood. What is it?
Mrs. Jones, this is a tube that doctors put between the ribs into the space around the lungs. It helps drain air, fluid, or blood from that area. It is usually seen after trauma, cardiac or lung surgery, and also an infection of the lungs when the fluid is built up in the space between lung and the ribs.
Wow, I always wondered why they put the patient through so much pain with all those tubes in them. Now I realize that those tubes, monitor, and devices are to help the patient feel better, faster.
Miss Jones, Mr. Jones is doing better on a respirator. His oxygenation is better, and we will have a few family members visit him in the next 30 minutes.
Some ICUs have visiting hours to help the nurses take care of the critically ill patients, whereas other ICUs have more flexible visiting policies. In either case, when patients are very sick and they're being cared for, our staff may ask you to wait outside so we can attend to your loved ones uninterrupted.
Dorothy, you were telling us earlier about the team of people who take care of the critically ill patients. Can you tell us more about them?
Certainly. The attending physician is the senior primary doctor in charge of the care of your loved one. These doctors have the expertise to take care of critically ill patients. They often specialize in certain areas such as surgery, trauma, lung disease, critical care, anesthesia, heart disease, or pediatrics. In a teaching hospital, these doctors also supervise junior doctors. The attending physicians are part of a group that works as a team. The same doctor won't be here every day. Another doctor may be taking care of your loved one, while your primary attending doctor may be off for the weekend to take a rest. In some hospitals, there may be the intensive care unit fellows who have already completed the training in the specialty and are now obtaining additional training in critical care or trauma.
Dorothy, can you tell me the differences between a resident doctor and a respiratory therapist?
Resident doctors in the intensive care unit are the doctors who are learning about the ICU care as part of their basic training in their specialty. Respiratory therapists are the allied health care providers who are specially trained to care for patients with breathing problems. The respiratory therapists know all about the respirators. They also give the breathing treatments and provide each patient the right amount of oxygen under instructions from the doctors.
I heard that nurses and doctors manage their patients from far away. Is that true, Dorothy?
That's correct, David. You're referring to the telemedicine. Many hospitals are using technology so that your loved ones can be cared for remotely, as if the doctors are standing next to your loved ones. The technology nowadays is so powerful that even a specialist in another state or country can see even a small lesion on your loved one's skin without any difficulty and talk to them as if they were right there with them.
Wow.
Miss Jones, you and your family can visit Mr. Jones now. He is resting on a respirator, and since there's a breathing tube in his mouth, he may not be able to talk with you, but he may be able to nod his head yes or no. He might be a little groggy as well.
Thank you, Nick and Dorothy, for explaining to us all these things in advance. Otherwise, we would have likely been very scared.
Nick, when we visited Dad, he was extremely sleepy. Is that anything wrong or unusual?
Well, David, the tube in his mouth and the other tubes can be uncomfortable. The doctors give their patients some medicines to relax so they don't feel anxious and in pain.
Why did they tie my dad's hands?
Some patients in the intensive care unit have their hands restrained simply to keep them from hurting themselves, as they may accidentally pull out the breathing tube or a line which may be helping them.
Why can't my husband speak?
Mrs. Jones, this is normal, since when the breathing tube is put into place to help the patient breathe, it passes through the voice box. That makes it harder for them to talk. Also, they're given medication to help them relax, and that makes them sleepy as well. Once a patient is better and they don't need the breathing tube, the healthcare givers remove the tube and they can talk. Sometimes your doctors or nurses may tell you to try not to talk with them and be quiet when you're with your loved one. It may make it worse to have too much going on around them.
In the intensive care unit, besides the doctors, nurses, and respiratory therapists, several consultant doctors also see the patient. The patient's primary doctor may ask for assistance in specialized areas such as a cardiologist for help with any issues pertaining to the heart, or a neurosurgeon for any issue relating to bleeding in the brain. In addition, a patient may also have a dietitian who ensures that your loved one gets the right kind of food. This can help them feel better and heal faster. The ICU team also includes social workers and caseworkers who help the families manage the social issues that come up when a person is very ill. They can help the family with their health insurance, post-hospital care, rehabilitation, or any other therapy that your loved ones may need after the initial recovery. Your loved one may require a transfer to a long-term acute care facility, which specializes in taking care of patients who are sick and require longer time to improve. Besides the management of their medical condition, patients also undergo rehabilitation therapy to help them get back to their functional status.
Dorothy, can we spend the whole night with my husband?
Mrs. Jones, it is usually better for the family members to go home and get some rest, as when the patient gets better, then they will need all the help and support from the family. While they are in ICU, there are nurses and other health care providers keeping an eye on the condition of your loved ones. If there is any change in the condition of your loved one, they will contact you by phone with the numbers you have provided.
Hi, Mrs. Jones. I'm Dr. Surani. I'm in charge of the critical care team. Mr. Jones is doing better. We'll be able to get him off the breathing machine very soon. He'll still be very weak.
Thank you, Dr. Surani. Dorothy, how will my husband get his strength back?
Don't worry. He will be helped by the physical and speech therapists. The physical therapist helps the patient get their physical strength back during and after the illness. The exercise prevents muscles from wasting away. They also advise the patients about the physical therapy equipment they may need to get better. Speech therapists help your loved one with the problems related to talking and swallowing.
The hospital ICU also provides the services of a chaplain, a priest, or any spiritual services, and they can help the family with prayers. The ICU nurses can help coordinate these services.
I'm so glad my dad's doing better. But what happens if the treatment's not working and a patient is not getting better?
It's wonderful that Mr. Jones is responding to treatment. Unfortunately,